Parasites. Are we being controlled by parasites? This is a question I thought I'd pose today because it's quite intriguing. I've kind of dove into a few books around parasites the last couple days, and it's just intriguing the information that's in there. One of the quotes that's in one of the books, the Kalcker Parasite Protocol, it's around healing autism. The quote that they have in there is, the word parasite comes from the Greek word meaning one who eats off the table of another. One who eats off the table of another. Quite interesting. So with my title being, are parasites basically controlling our behaviors? Are they controlling us? And from what I've read, they can and they are. If they're in our system, they're affecting our behavior, how we act, what we're eating. There is let's see, Parasite Rex by Carl, I can't read his last name, Zimmerman, I think. Carl Zimmer. And they basically talk about a study where they had cats and rats. And I'm not attempting to rhyme here, it's just happening. And what they would do is, because obviously cats are in the wild and they would be hunting their prey, which could be rats for one. And rats are programmed to know that when they smell a certain kind of urine, basically cat urine, that they respond with anxiety and then change what they're doing. They go somewhere else because they know there's a threat there. Where, I don't know if anyone's heard of toxoplasmosis. This is something where mainly you might hear about it if you are someone who is looking to be pregnant or is pregnant. And the doctors will tell you to avoid changing cat litter. This is where we have the susceptibility, or one of the known susceptibilities, of having toxoplasmosis, which is a parasite that's found in cat feces. And when you're stirring up the litter box, this is when it can come in the air, and this is when we can breathe it in. So with this particular study that was taking place, the rat was infected with this toxoplasmosis and actually caused the rat to act differently. You see, parasites, their main goal is always to survive. They always want to survive. And how do they do that? In this case, the parasite caused the rat not to respond normally to smelling cat urine. In the study, they had different animals' urines in the area, and it was only the cat urine where the rat would respond differently because they knew that was a threat. Where when the parasite is on board, the rat acted differently and didn't really respond, didn't have that anxious reaction to the urine to know that there was a threat there. There was a hazard to their life. And the rat just continued on its way, exploring the area. So this is kind of where they go into them parasites kind of changing the behavior of animals. And it's not just animals, it's us as well. Because what does it say here? Let's see. I like the line that they use here. By turning rats into rodent kamikazes, toxoplasma probably increases its chances of getting into cats. Again, it's the whole idea of parasites want to thrive and they want to survive. So this is one thing that they can change behavior on. And I find it quite fascinating. I don't know if anyone else is interesting or grossed out by this, but it's very interesting things that are out there. More on toxoplasma. This refers to that as well. Infected rats also became hyperactive and displayed more reckless behavior, which led to these rats more likely to be caught and eaten by cats, which tended to attract fast-moving objects. Book Your Brain on Parasites went into further discussion controversial research that suggested that similar effects may be happening to the behavior of people who are affected by toxoplasmosis. The suggested link to human behavior seems plausible because toxoplasmosis will infect the host neural tissues, including the human brain. So this basically, they cited studies where it suggested the infected person may display personality changes, increasing impulsivity, less fear, and poor judgment in potential dangerous situations, such as when to speed up when passing a car, or they might indulge in more reckless driving habits, et cetera, et cetera. So it's very intriguing to see how parasites can impact us. And we may not even be aware of it. This is where it's very helpful for us to be able to test and see if you're being affected by that and how to handle it. Let's see. This is Your Brain on Parasites. This is another book. They consider, you can kind of consider yourself being in the driver's seat. And now in this book, they kind of refer to the parasites being in the driver's seat. Parasites are like that invisible passenger, adept to outwitting our immune systems. They sneak aboard our bodies, and then the devilry begins. I love the words that they're using in this book. It's great. They cause rashes, lesions, aches, and pains. They eat us from the inside out, use us to incubate their young, sap our energy, blind, poison, maim, and sometimes kill us. It's pretty extreme, but if they're on board, they're causing all sorts of problems. Simply stated, these parasites are masters of mind control, whether as a virus, which viruses are the smallest of parasites, if you read the Merck manual, which I have on the shelf over there, or as big as a 6 foot long tapeworm. They have found all kinds of devious methods to manipulate the behavior of their hosts. This includes many researchers now strongly suspect humans. That's me, that's you, and yeah, it's pretty crazy. And we've talked about many times that we are impacted by parasites around the full moon. If you're a teacher out there and you notice the children in your classes acting differently, this is where that can come into play. I know for myself, I used to work in retail. I know Kate is watching and used to work in retail, or even I worked at a vet's office for a few years when I was growing up. And if you're in any of these fields, or if you work with a field that you're involved with people often, do you notice a change around the full moon? Do you notice different activities, different behaviors? Maybe they're a little more hyperactive. Maybe they're craving more sugar. Maybe yourself, you're looking for more sugary things. This is because parasites love sugar. And it's just kind of a simple example of how they can impact what we want to eat. And by eating sugar, obviously that causes a lot more issues as far as inflammation and anxiety, and even tempted to more irritable. Yes, definitely. Kate, who hasn't seen humans become more hyperactive around the full moon? Yeah, exactly. So I'm going to go through a couple other things just because I want to start with the behavior part because I think it's a different approach than I've kind of covered before, and just I found it kind of interesting. So parasites, obviously, they are the pathogen that lives on another organism, either us or some other animal. There's 3 different main types of them: protozoa, helminth, and ectoparasites. Ectoparasites are probably ones you're more familiar with, more familiar than you even know, because that includes parasites that will attach to your skin and feed on your blood or your tissue. This is your ticks, your fleas, or your mosquitoes. Like I had never, before I was researching all this stuff, I hadn't never considered that a mosquito was considered a parasite. But in the definition, it makes sense because they're feeding off their host and they're looking to gain something from you. So, and as I've kind of mentioned, they can be microscopic in size. They can be, you can't even see them by the human eye, and they can be up to, as one of the books said, many feet long, which is, I know, really gross, really gross, but it's also very fascinating. They can be found anywhere in the body. They can move around in the body. So we've all seen those shows out there on TV where they have, it's usually the ER or your hospital shows where they've got someone who's in surgery because it's some sort of weird parasite in the brain. Anyone see that Grey's Anatomy episode from years ago? I'm sure you've seen an episode somewhere. This is just their way of showing us that they do exist. They can be in your brain, and they can be in your heart. They can be anywhere in your body, your lungs, your intestines. And think about your pets for a second. Who out there has pets? I know we have a dog. And when you go to your vet, or maybe if you have a horse, whatever animal you have, very often, at least I think maybe twice a year, they are deworming your animals, your dogs, your cats, horses, probably others that I'm not mentioning. They deworm your animals. And heartworm is the biggest one, I think, that we kind of are familiar with when it comes to our pets. And the toxoplasmosis, I guess, with the cats. But these are things that affect the health of our animals, and we're deworming them. And that's here. I'm in Canada, and that's affecting us here in Canada. It's not just a warm climate or subtropic area that's being affected. They're here affecting our animals. And that is where we can be impacted by parasites as well. We can get them from our animals. We can get them from walking barefoot outside on the beach, playing in the garden. They inhabit when you're eating raw or uncooked meat, sushi. They can be there. There's probably lots of videos if you dare to search on YouTube, parasites and medical procedures, and maybe people who are opening up fish or something like that. They're out there, they're gross, but it's intriguing. So these are areas where we can be impacted by parasites. And this is something you really want to know, because they're affecting our health. They're affecting our health more than I think many want to admit and many want to know about. They can also be in the air. They can be in the water supply. So why do we care about this? Kate and I, we've had a few clients recently who have had issues with anemia. And if anyone has even listened to us before, you might be aware that anemia can be related to parasites. We've also been looking into the issues with around stomach acid. If your stomach acid is low, if you're having heartburn often, this is kind of a little side note, but if you're having heartburn often, this is affecting how you break down protein, if you can break down protein, and then are you getting the nutrients from that? And by not being able to do that, that is affecting your iron levels. So that's a side note. But parasites, there are parasites out there that will eat your red blood cells, that will affect your anemia, your iron levels. And roundworms are one specific that are tied into this issue. So that there's a bunch on here: hookworm, strongyloides, whipworms, pinworms. There's a few others on there. Some of them are a little more challenging to say. This one says in brackets, dog heartworm. So that's interesting. And symptoms around roundworms specifically. This is from Parasites, The Enemy Within, which is kind of, again, a fun title. Let's see. I can't see the name of who this is offhand. Anyway, it doesn't matter. If you wanted to know, you could always message. Symptoms to look out for when it comes to roundworms. Grinding of teeth at night. I know I've been there. I've been told I used to grind my teeth. Intestinal gas, allergies, asthma, snoring. So if you have a spouse out there who is snoring, this could be affected by parasites. Digestive disturbances and anemia, as I had already mentioned. Restlessness. I know sometimes I can find myself, I'm just moving, I can't stop moving my legs. And I mean, parasites is something I continue to work on because, as Kate's commenting on stomach acid here, stomach acid is also important to keep your bug population in check. Yes. If your stomach acid is low, meaning you probably have been experiencing heartburn, this is when your parasites, your pathogens, this is when viruses and things can impact your body more so, because you don't have the ability to kill them off. There is an imbalance in your body. Pardon me. And the last point on this particular one, symptoms to look for with roundworms: weight gain around the full moon. And it actually says in brackets, sometimes 7 to 8 pounds, which is quite alarming to think. 7 to 8 pounds. So if you're dealing with things like anemia, one of our clients recently had the iron infusion shots, and the numbers for iron levels were better. And then I can't remember how many months it was, a few months later, maybe, and the numbers went right back down. You have to think, the infusion's not solving the problem. You're not getting to the cause of why you're experiencing that low iron. There's another reason for it. And that's something you need to look at. Like, what is the actual cause of that? And maybe it is parasites. Maybe it is parasites eating your red blood cells and causing you to feel this low energy. Or maybe it's just your stomach acid is low and you can't get the nutrients that you need from what you're eating. Here we are. 6 months went from 100 plus to 13. Yeah, that's pretty significant. And this is just recently that we tested and we found that parasites were at the cause of why our client was experiencing low iron. Low iron, yeah. And I know there's many other people women probably more so, that are dealing with low iron issues. So that's just one of the symptoms that you can experience from parasites. Other ones could be abdominal pain or discomfort. I've kind of covered some with the roundworms. Anxiety. Anxiety could be a thing. Bedwetting for kids. If you have kids that are wetting the bed, that could be an issue. Constipation, gassiness, nutritional deficiencies. But that could be, maybe that's tied into the low stomach acid. There's so many things that could be at play here. Arthritis, allergies. What else haven't I mentioned? Headaches, low blood sugar, seizures. Seizures are a big one when it comes to parasites. We know another fellow practitioner who had this issue years ago before they started getting onto a program, and parasites were found to be the cause for their seizures. And by getting on a program and handling the parasites, that was able to go away and get better. And it's mind-boggling to me, just to, as I said, I keep researching and finding more information about what parasites are at cause for. And it's just mind-boggling that it's not discussed more in the health industry. Natural health, it's definitely more discussed, but your traditional space, if you will, is not on top of it. They are more active at night, these parasites. This is kind of when, maybe you've got those cravings coming because they do want that sugar. They want carbs. They want to survive. They want to keep living inside you. They lay lots of eggs to continue on with their, I'm blanking on my words. Anyways, they lay lots of eggs per day. And the range that I found was different when I searched for it a while, but one parasite lays about 5,000 per day. 5,000 per day. That's pretty crazy. And the range that I found was anywhere from 300 all the way up to 200,000. That is a lot of eggs and a lot of problems they can cause. Where are we going here? Let's see. So kind of, there are testing that can be done for parasites. I know, again, I've talked about all this stuff before, and if you want to kind of dive into that a little more, you can look at older parasite videos I've done. But there's other things that they can be, like maybe they find parasites in you, but it's being misdiagnosed as something else. These conditions can include cancer, lesions in the lungs, brains, kidneys, liver, cysts in the kidneys, uterus, ovaries, and masses in the testicles. So why are these things being formed? Well, this is like anything else that's in your body that it doesn't know what to do with. It doesn't know how to get rid of it. So maybe you're not detoxing well, or your stomach acid is low. There's an imbalance somewhere, and your body's overburdened and it just can't handle things and get it out of your system. So it's going to store things. It's going to protect you. It'll put it encapsulate it however it sees fit, because your body is very smart and knows what to do. And that could result in any of these things that I just mentioned. And it's protecting us from toxins. It's protecting us from parasites. And the best way for us to figure out what's going on is to test you. That's always the best way. If you're curious to know more about parasites, throw some comments in there. We'd love to talk more about it. As I said, I've got some books that I'm looking into. I just ordered another one yesterday, so we'll be looking into more information on parasites and how they are affecting us, because I think it's one of the greatest things that's affecting our health more than we know. And this is something that we can help you with. We can test to figure out, one, if you have them, are they affecting you, and what you need to get better and get rid of them. And it is a process, let me tell you, because it's been months and months for myself, and they still surprise me when they exit the body. let's say. And currently right now we have our Boxing Day special. Our um, assessment bundle that we do is $99. So I think you believe you're saving $60 on that currently. So if you've been curious about what we do and how we work, if you want to find out more about that, just send us a message. Or if you are gung-ho and looking to get started on creating a better health for yourself for 2024, this is a great opportunity to do that. $99 to get started. We want to talk to you and find out more about what's going on with you, because whatever you've been experiencing, it's not all in your head. You know your body well. You are the one who knows yourself best and what's going on in your body. Don't let anyone tell you differently. And we're here to listen and hear what's been going on, and just we can help you best by finding out more about you. And from there, then we'll just test and figure out what's going on with your body and then what your body needs. That's kind of the simplest way to put it. So if you're looking to have a better outcome with your health for 2024 and beyond, because it starts right now with a decision as far as what you want. What do you want your health to look like? Without your health, you basically, what do you have? Especially if you are a business person right now, an entrepreneur, if you don't have your health, who is taking care of your clients? Who is taking care of your business? Who is taking care of your family if you have a family as well? Who is doing these things? It's so important to get on top of your health now. You may think maybe there's nothing going on, or maybe it's just because the little signals from your body have just become the normal. And it's just as simple as me. I'm often clearing my throat, but this is something I'm personally working on myself. And maybe there's other people out there who have a normal clearing of their throat, a normal headache, maybe normal sinus issues, maybe they're normally constipated, whatever it is, whatever the normal you think you have, it doesn't have to be normal. Again, see? Many things are common. Many things are common, but not normal. And if you're ready to get started working on your health, Kate and I are here to help you. We'd love to help you get to that better place of health. So if you're looking for that link, it'll be on Instagram, or just send us a message and we can chat about it. Love to have a conversation. Thank you everyone for tuning in. If you don't mind, if you're watching live, you can put the hashtag live on there. If you're watching the replay, put hashtag replay on there. We'd love to see who's checking us out and who's enjoying the information we're bringing. And if there's anything else that you want us to talk about, you can let us know. We'd love to hear. So, and also have a happy new year to everyone out there. I forgot that's a couple days away. All the best, and have a safe holiday with your family and friends, however you celebrate.